Hi, this is my name's Joey Elizondo, and I'm a physician assistant here at the Wound Care Center here in Lubbock, Texas. Today we're going to talk real briefly about maggot therapy, which is a form of debridement that we use. Maggots have been used for centuries. Actually, in World War II, they used them a lot, and the Civil War. And a lot of times the soldiers that had wounds, they leave the maggots there, and the nurses and the medics realized that it was actually benefiting them. And these maggots were actually more useful. And so there's not many clinics here that use the maggots in the United States. We're a clinic that actually uses pretty much everything that can help the patient. We can use debridements through sharps, but sometimes it's not warranted because it may be too painful, or you don't want to make the patient bleed a lot. So another option that we use is maggot therapy. And today I'm going to instruct on how to put the maggots, as well as preparing them, as well as removing them here at the Wound Care Center in Lubbock, Texas. So real simple, I make sure that the nurses, what they do is they keep the wounds open here with saline. So now I'm going to put the maggots here. So I try to be real gentle with them because they're pretty much, I kind of put them there. As soon as they start seeing the dead tissue, they actually start eating it. These maggots are sterile. They're grown in a laboratory, and they're free from bacteria as well as viruses. So it's not like we get a carcass funded on the long side of the road and then we just pick up the maggots. I don't think that'd be a good idea, but so I'm gonna try to.
Doc. Yeah, thank you.
When we get them from the laboratory, they're in a little gauze-like fashion here. You can probably see that there's hundreds or probably even thousands of maggots. So what I'm going to do here, and I make sure it's saline, and I always tell the nurses or other practitioners, I really don't like using any type of a dermal wound cleanser because it's very acidic. It can actually damage or kill the maggot. Resort for infected ulcers. We don't think that's necessarily right all the time. We can use them as early as soon as we find a lot of necrotic tissue and gangrene, of course. See, can I get a shot of this one here? When we're trying to debride it by sharps, as you can see here, they're pretty much eating up on it and taking all the dead tissue. As you can see, the granulation tissue right here, they're hardly touching it. You can probably see a couple of them that are trying to eat the biofilm there on the surface. As you will see that they'll start eating up all the edge of the border and clean it up and expose the good tissue. So I think we're pretty much done applying the maggots here. While he was at the hospital, we found that there was a little tracking here where it was bacteria was actually traveling underneath the plantar area right here, which was a deep foot infection. Now these they will feel tingling sometimes. Right? You feel some tingling?
Not really, no.
And sometimes the tingling can also be the diabetic neuropathy. So it's actually, maggots would not interfere with the, or not cause any excruciating pain because they're actually not messing with the nerve endings, just on the dead tissue.
pensaba que era medicina, me dijiste, yo todo
Yeah.
pensaba que era medicina.
So now we're gonna cover them up. First, I'm gonna use strips here on the wound bed just to let the maggots know that they're not crossing that area. It's one of the you can use a Duoderm or Mepilex, whatever you have on handy. It does two things. It protects the wound and also protects the maggots from going further out. So I want to thank Mr. Basan for letting me film him put the maggots. And I'm going to go ahead and have my nurse secure the dressings, and we'll still continue recording so you can see the proper procedure. And then we'll take it from there. And this is Joey Elizondo from the Wound Care Center here in Lubbock, Texas, and thank you for watching.
You feel them yet?
No?
No?
Not yet.
Not yet. Some people say they can feel them.
Really?
I'm just gonna wrap you up, okay?
Okay. When you look at Kate Mackey, the doctor is talking about some kind of medicine.
That what?
I thought he was talking about some kind of magnet. You know, when he said magnet.
You didn't know what he was talking about?
No. I said, I'll give you what I'm thinking.
You didn't
He
think it was
but I
real, huh?
It was what I was thinking.
The bugs.
Yeah. When they make that hole there, the infection, no me, pues, I
Felt
had a
better?
lot of relief. I don't feel nothing anymore.
Good. You were hurting pretty good
Yeah.
for a couple days there.
Good application. Today we're going to remove the maggots. As I talked about earlier, that we usually wait 24 to 48 hours. I generally left it for 48 hours just because of the degree of necrotic tissue that was on the wounds. So I'm going to go with the right foot first because this is the one that was most affected. And here they are. So when we talked about that, they kind of grow in size within a matter of days. And they sure did. You saw the size that was maybe about half a centimeter. And you see they're a little bit bigger. And we talked about earlier, we're putting an adhesive barrier there. It actually confined them. See, Mr. Basan here is amazed at how the maggots work. And sometimes as the wet to dries tends to stick the wound bed. So I gotta be very careful here. I'm gonna scoop them out. Yeah, there's.
Ah, they're big, huge.
Yeah. You heard it from the patient. They are big.
Thanks for all seeing. All right, man. Actually, I'm gonna be ready for Tuesday. Okay.
So I'll make sure that I leave no maggots behind. If you notice, the surrounding tissue here is more of a normal color as compared to cellulitis. They also reduce the inflammation around the tissues. I'm going to take off the top part as well. If you look on the base, you see there's granulation tissue right underneath where the maggots ate through. So they did their job. As you can see, the top part, they ate up pretty much all the dead tissue around the edges and the center of the wound bed. These did grow a little bit bigger than the ones on the bottom.
Oh yeah?
Yeah.
más, hijos.
When you're done with this one, I'll change the battery.
Okay.
Your right hand's in the way.
Mira, te lo limpió todo hasta el hueso.
Hey,
That's good.
O sí, me dijo la señora, pues no sé, dijo,
¿Es home health?
yo no sé si si lo único fuera que si lo quiera poner como una rehab, parecía que algo decían Medicaid. That would probably be the only way que pudieran hacer.
Yeah.